Welcome, 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 my people. I miss you all. Please, as you are joining us, share. Welcome, welcome. I miss you. How many people are here? I miss you guys, my families. I miss you. Who miss me? I miss you all. Welcome. We are going to go straight. I will not waste time. Okay, Osa Giving, welcome. If you are joining, share. I miss everybody. In fact, it looked like as if I left my children. I miss you all. Forgive me, it's time, but I was able to be posting some videos. I hope you all are doing well. I received a lot of questions pertaining this topic you saw there. That is why I said today I must create that time to discuss about it, because it's a very big issue. And also I want to address this. We are still waiting for the result of our prayers. A lot of people, I may not be posting it because a lot of people conceived already, but they had miscarriage. They have what is called chemical pregnancy or early miscarriage. So I want to address that before I continue. I told you guys that the prayer we made is an agreement prayer. You need to chill down. You understand what I mean by chill down? Cool yourself. Avoid anything stress, anxiety, disturbance. This can lead to early miscarriage, which is known as a chemical pregnancy. Some people might not even know that they have already gotten miscarriage, because it will confuse you between the implantation and the pregnancy. So please, if you are expectant mom, if you are hoping to conceive, please, I beg you in the name of God, hold on. Don't bother yourself. Don't stress yourself. Stress can lead to what is known as chemical pregnancy. I don't want to hear that news again. Since Sunday, I'm not happy. I receive at least 2 or 3 people that have these early miscarriages, because they were so anxious, They were so anxious. I told you guys, I told you people, you don't listen to me. Don't worry about how God is going to do it. We have prayed. Don't go and be checking your period like the other person said her period was supposed to come 3 days ago, but today she saw something like lightning. I told her, cool down. Maybe she continued going to toilet to wipe and to do this, and eventually the thing came out. So my dear sisters, I told you people, this page is an honest page. I cannot lie. I cannot deceive you. I teach you the best I know. I create this page to help women who are trying to conceive. Please, I don't want to hear this early miscarriage. I don't want to hear chemical pregnancy. I don't want to hear it. That is not what we prayed for. We pray for God to bless every woman. Not God doesn't add sorrow to joy. I told you that agreement prayer is just like people taking oath. When you take oath, if you don't keep to that oath, something will happen. So please have faith. Stop checking. Stop calculating. No, stop checking. My period supposed to come to. Don't check again. Don't check again. Please, don't check again. I was so sad. 3 people have chemical pregnancy, early miscarriage. This is supposed to be implantation, but they wouldn't allow because of stress, because of anxiety, because of worry. Don't worry. God have answered. Like I said, this ending of November, early January, we will start posting. Please, I beg you people. I don't know if those people are here. Please, cool down, chill down, mellow down. What God doesn't add sorrow to joy. Once God bless you, he has blessed you. If God put a baby there, it's there. You don't need to worry. So I think I have addressed that. I understand everything everybody trying to conceive is passing through, but at the same time, I will tell you the truth. Stress and pregnancy, they don't work. They are worst enemies. Please, please. So today I want to talk about ovulation. People are asking if what should I do when I am not ovulating. Now, you all know, my student here knows what ovulation is. Can I put a test? Who can define ovulation for me? Chichi, Emmanuel, or Okeke? Who if you define what ovulation is, because I've been saying it, I will dash you 1 naira. Who will define ovulation for me? Chichi, do you know the meaning of ovulation? Because you have to understand what this thing means before you know whether you are ovulating. Chichi, man, can you tell me, or is any other person there? Let me see. Let me see the people that I'm familiar with their face. Okay, Chuku Jennifer. Okay, Chuku, if you feel it, Okay, Chuku, what is ovulation? I don't know if you are here. Some people are just coming and going. Okay, please, what is ovulation before I continue? At least, it seems this class will be doing it. I'll be asking you people questions to know whether you understand. Please, if you are watching me, if you are joining me, share, like, and God will bless you. Ogechi, I saw you here. Ogechi Jennifer, what is ovulation? Let me ask anybody that get it, I'll give the person 1 naira. Ogechi Jennifer, what is ovulation? If you don't answer, waiting for you people. Okay. Henry Quinnet said, ovulation is the process in which a matured egg is released from the ovary. Yeah! Henry Quinnet, you are my best student today. I will give you 1 naira. No, €1. €1. If you change it, it will be. Everybody clap for Henry Quinnet. Zini said, Zini Lover said, ovulation is the release of egg from the ovary. Zini, you got it, but you missed something. Ovulation is when a matured egg. The egg must be matured before it will be released. So, Henry Quinnet got it complete, but clap for Zini too. Jessica, is the release of matured egg from the ovary. Yes, Gladys, you got it. Victoria say ovulation is a mucus discharge that. No. Victoria, are you new to my channel? Ovulation is not a mucus. It's not a mucus discharge that come out. No, that mucus is one of the signs of ovulation. In fact, sign of fertile days. That one, Victoria, your definition is wrong. Ovulation is when a matured egg, after your period, you enter the phase they call follicular phase. In this follicular phase is when the follicles start developing, growing. When they get to maturity age, they will be released from your ovary. So it's not that discharge you see is just a sign to show you that your body is fertile, that you are approaching your fertile days. It's not ovulation, but it's one of the signs of your fertile days. A blessing egg is the release of matured egg from ovary. The first person got it complete. So Henry Quinnet, you win my €1. So now let's continue. This is how I'll be doing it, so that you people will be following what I'm saying. When I teach, I will ask questions for you to know whether you understand what I'm saying. Favor swings, the ovulation is the release of an egg from the ovary into the fallopian tube. Is the first person got it, the egg must be matured. If the egg is not matured, it will not be released. That is the problem people who have PCOS have. PCOS, they have small follicles in their womb. At the end of the day, none of them will be matured and none of them will be released. But when the egg is matured, then it will be released. So I will stop here. Let me answer the question. Somebody said, Ma, if I am not ovulating, what should I do to become pregnant? Ovulation is something that is very easy, and if you watch yourself very well, you can do it without doctor's supervision, and you become pregnant on your own. Now, if you are not ovulating, by the way, how do you know that you are not ovulating? How do you know that you are not ovulating? The ways you will know that you are not ovulating: one is your inability to get pregnant. If you have been trying for a very long time, I know that infertility can come from both parts, either from your husband or from yourself. But the one you will know that you have fertility problem is when you are trying to get pregnant and it is not happening. Then you will know that you have problem. So please, 57 people, I beg on now, see my hand like this, share the video so that people will see it. So now, how would you know that you are not ovulating? I've said the number one, that if you have been trying, if you're a TTC mother trying to conceive mother, you have tried a year, 6 months, you are 35 years, you have tried for 6 months and nothing is happening, there is a problem somewhere. Another way you can find out that you are not ovulating is by using the signs of ovulation. I have made several videos about signs of ovulation. You go and watch those signs. Do you notice them? Do you observe them? These signs, are they happening to you every month? Something is going on in your system. Something is going, God is working in your system. So if you are not noticing cervical mucus, like the person wrote here, cervical mucus is the one of the signs of fertile days. Whenever you see that sticky, I have made several videos about it. If you still want me to make video to demonstrate it live with egg or real cervical mucus, let me know. The cervical mucus, after your menstruation, you enter the follicular phase. In this follicular phase, the first cervical mucus you will be seeing, it will be sticky, like how will I put it, like cheese. You will see the cheese one is not fertile one. Then when you are closing to your fertile days, like I always tell you that your fertile days start 5 days before your ovulation. Now when you are approaching your fertile days, you will see it will start drawing like egg white or kata. When you have cold, the code will be slippery like this, but if you draw it, it will be sticky. Then you know that you're approaching, that is not ovulation. Oh. You may see that thing, but you have not ovulated. That is sign of fertile period, which means you are entering your fertile days. So when you see this, you start baby dancing. Now, if you are not seeing these things, it's a sign that your body is infertile. And what can cause your body not to be fertile? You might have health issue. You might have Zini, love it. Don't write question. When I'm finished, you can write question, because as you are writing it, I'm not seeing it. I'm talking. Listen to me. When I'm done, you can write. So when you have health issues, age, low ovarian reserve, low egg quality, all these things can lead to that. Some people, when they want to ovulate, they have pelvic pains. A side of your pelvic will be paining you. Some will have light spotting, not bleeding, light spotting. Some will have headache, some will have fever, some will have tender nipples. Many signs of this. Are you seeing this? So another way you will know that you are not ovulating is by visiting your gynecologist. This is very, very important. It's very, very important. If you are not ovulating and you want to ovulate, because anytime you are not ovulating, it simply means there is a problem. There is something that is making you, as long as you have not entered menopause. Some people enter what is called premenopause. Some people enter menopause before their menopause time. But if you are not up to 50 years and you are not ovulating, please go and conduct hormonal test. That hormonal test, they will dictate whether you have your thyroid gland is functioning or not. They will find if you have hyperprolactin. Some women, they are not pregnant, they are not breastfeeding, but breast milk, when they press whether press or not, you will see breast milk gushing out from your breast. I said breast milk, not water. Water is not a problem, but when it comes to milk, that thing is very, very serious. It prevents women from ovulating. Some women, they have low progesterone, And these people in my page that have chemical pregnancy, that is early miscarriage, I will advise you, if you are here, please go and do progesterone test. Once your progesterone, remember, okay, let me throw another question to see whether my people are following me. Now, who will tell me the function of progesterone in pregnancy? Oh yeah, who will be the first? The person will get €1, 50 cents. Who will tell me what is progesterone? I'll be saying it. If you are following me now, we know people that are listening to my teaching. Henry Quinnet, if you are here, answer this question. What is the role of progesterone in pregnancy? I'm waiting for you. If you didn't answer it, I will not continue. I'm waiting. Who will get the answer? What is the role of progesterone in pregnancy or in conception? I dey wait. You see, I wear my eyeglass. Today I have time. It's not when I will come, I will run. Today I have time for you people. Progesterone is a hormone that helps to prepare you for pregnancy. No, isn't it? You tried, but not. I want to know the role progesterone play in pregnancy. Like I told you people that thyroid gland controls your body system, and it controls the FSH, LH, so that is luteinizing hormone that prepares the egg for releasing. I talked about estrogen. Estrogen prepares or thickening the lining of your uterus so that the fertilized zygote will implant successfully. I talked about which other one? Thyroid, prolactin. I've talked about prolactin is responsible for breast milk. Now, tell me, you people will be my teacher now. What is the role of progesterone? If you don't know, go and check it in the Google. Use your phone. Okay, Johnson said progesterone helps to prepare the body for pregnancy by stimulating glandular development and the development on the blood vessel. This provide a good environment for implantation by a fertilized egg. Let me see. You want to dictionary by a fertilized egg. If the egg isn't fertilized, the couple's uterus break down. Johnson, you got it. You got it. Johnson got it. Johnson got it. I want to see another definition. I want to see. Now we'll be learning together. I will not be the only person teaching. Johnson, you got it. The one word I want to hear: by stimulating glandular development and the development of new blood vessels. It helps the womb grow during pregnancy and keep it from having contraction. Yeah. No, it's not implantation. No, princess, is not implantation. You are out of the line. So all the people, 71 people, only 2 people have made sense here. Please share this program. I'll be waiting for you. You must learn. You must learn so that when you go to the hospital or to your doctor, they tell you have this problem, you will know. You know what you are suffering from. You will not be afraid. It's not every time I will come here and be talk. After talking, you will see people asking you the same question. So let us learn together. Progesterone help the uterus not to contract. Another definition, please. I thought by now I would be struggling to read people's comments. So many people are just coming here to look at my face. It's only Johnson and who else that made sense here. I will simplify the meaning of the role of progesterone in pregnancy. Wait, I don't want to miss any this thing. I don't want to. Progesterone helps to prepare the body for pregnancy. But okay, this is Johnson. Oh God, why am I missing this? I don't want to miss any this thing. Ovulation is no. It is responsible for the preparation of endometriosis, for implantation process and maintenance. Nobody have gotten the simplest way of, so that a layman watching us here will understand. Its main function are regulating menstruation and supporting. Period. Who is this? Henry Quinnet. Henry Quinnet, come. Henry Quinnet, you won the other 150. You won the other 150. Now you are winning again. Henry Quinnet got exactly what I mean. Henry Quinnet and Johnson, they got it the simplest way. In fact, Henry Quinnet simplifies it. Its main function are regulating menstruation and supporting pregnancy. Progesterone support your pregnancy. Once your HCG increase, once your body you become pregnant, your HCG will signal all the parts of your body. Now new embryo is coming. A new embryo is coming, and prepare a way. In fact, it will signal the body to support the pregnancy. So when you are having miscarriages, it could be, I am not saying that it must be as a result of low progesterone, is maybe you have low progesterone. So those people in my page that is having chemical pregnancy, what you mean by chemical pregnancy is early pregnancy. You miss the pregnancy, you lose the pregnancy before you even notice that you are pregnant. Why they are showing me, why they told me about it is because they are following their system. So the role of progesterone is to support the pregnancy, and this progesterone will keep on supporting your pregnancy up to 6 to 3 months, when the baby will start producing their own progesterone. So stress can make you to have miscarriage. Infection can help you to have miscarriages. Fibroid can also lead, but in most of the cases, low progesterone level can lead to series of miscarriages. So why I'm saying this, if you are here and you have been having series of miscarriages, you need to have your progesterone level checked. And maybe if it is because of that, your doctor will place you on progesterone suppository or maybe injection that can help you. And when do you start saying this? I have displayed the medication here several times. Or maybe you go to my page or Tochi's channel on YouTube, you will see it. How you start using it is immediately you ovulate. You must know when you ovulate. If it is doctor that prescribe it to you, doctor will tell you when to start using it. When you ovulate today, tomorrow you start using it. Why? Because if you ovulate today, it simply means that the egg has been released, and within 24 hours, the egg will be fertilized. If the egg fertilized, the egg will start traveling down to your fallopian tubes, where it's going to implant itself. So before the egg will get there, this progesterone level, which will support your pregnancy, will increase. So now, I don't know what brought me about progesterone. So I was talking about 4 hormones that can help you to get pregnant. So if you have what is called hypothyroidism or hyperthyroidism, in the issue of hypothyroidism is when your thyroid gland is underactive. What does it mean to be underactive? When your thyroid system is low, you find out that sometimes most of the women, you always feel weak, tired, fat, despite the fact that you place yourself on a diet, your body refuses to slim down, and also it will stop you from ovulating. But in the issue of hypothyroidism, doctor can prescribe medication for you to fix it. I have it also. So that's why I said it's always good for you to go for hormonal test. If you know what you are suffering from, you will not be suffering from infertility. So when it is hyperthyroidism, it means it's excess. So the thyroid gland helps to produce what is called FSH. That is FSH that helps trigger ovulation. Then LH surge is luteinizing hormones that prepares the follicle for release. So another one is I talked about hyperprolactin, where your breast milk is coming out. It means that you are pregnant, and you are not pregnant, you are not breastfeeding, and every time you will see breast milk coming out. This thing is, do you know that another way of family planning, like somebody like me, if I'm breastfeeding, I will not be ovulating. Some people, when they are breastfeeding, they can get pregnant. If I am breastfeeding, I don't ovulate until I stop breastfeeding. So if you are the type in my shoe, your breast milk is coming out from your breast, simply means that you might likely not to ovulate. So how do you find out? How do you fix the problem of anovulation, or that you are not ovulating? By going to hormonal test. Going meet your doctor. Don't go, some people go to the lab. No, the lab will just conduct the test in as much as they understand the analysis of the result, but they wouldn't explain it to you. And you going on your own to conduct this test, after you go to the doctor may ask you who prescribed this test for you. So the first thing you will do, you must use OPK, ovulation prediction kits. I have showed it here several times. Use it. If you have 28 days cycle, please start testing on the cycle day 11 to know when you are likely going to ovulate. So if you start on day 11 and conduct the ovulation test throughout that cycle and you didn't see the control and the test line positive, it simply means that you are not ovulating and there must be problem. Then you go to your doctor. People who have irregular period, what I mean by irregular period, we have two types of irregular period, whereby the first one is you don't menstruate every month. You know that every month you don't menstruate, you don't ovulate. Some people, their menstruation is all over the place. This month they will see it 26. The upper month, this is the worst. I don't like it. It makes people difficult to conceive. It makes it difficult for you to calculate your ovulation, but you can still defeat this. You can still defeat this system. Do you know why you can defeat it? By having regular sex. Don't wait and said, they said 25 days. If you know you have this type of period that is all over the place, that doesn't have cycle, please, the way you can defeat it is by making regular love. Baby dance with your partner, then you will defeat it. But if you are waiting, you may be wasting your time because you don't even know when you are likely going to ovulate. So if you have 21 days cycle, which is the shortest cycle, start making love on the 7th day of your cycle, because that is the day you are likely going to ovulate. So with now, please share this video. If it touches you, if you like what I'm doing here, you can donate stars. So in the absence of all these things, maybe you go to your doctor and you tell them that you are not ovulating. They must watch your ovaries, they must watch your uterus, they must watch your vagina, they must watch everything. And when they discover that you need help, then they may decide to give you help. And how do they do this help? Your doctor may prescribe something like this clomiphene. I think in Africa you people call it clomid. Your doctor may prescribe this clomid for you. And please, disclaimer, this is not simple. It's not what do you call it? It's not my drug. It's not paracetamol. It's not crayfish. You cannot buy this without doctor's prescription. I hear a lot of people in Nigeria, they will say, if you want to get pregnant, if you want to give birth to twins, go and buy Clomid. If you buy this thing on your own, you are causing more problems to yourself. It must be prescribed by a medical practitioner, a medical doctor, not quack doctor, a medical doctor. So when he or she prescribes this for you, he will tell you when to start taking it, and he must watch you so that you don't develop what is called hyperstimulation of the ovary. It's not everybody that needs this. It's not everybody that needs this. If you have hormonal disorder, for example, even if you take Clomid can never force your ovaries to release egg. You must fix that hormone that is not in order. If you have hypothyroidism, whereby your thyroid gland is low, you are not producing FSH, if you take carton of this, you can never become pregnant until you fix it until you take the rightful medication. So don't think that, oh, I'm not ovulating. They said Clomid boosts ovulation. Is the worst thing you can do to yourself. The process of taking this thing, you might develop cyst, ovarian cyst, diamond cyst for that matter, that needs surgery. You might develop fibroids. You might develop, what do you call it? You might develop many ailments that can cause your fertility. So please and please, before you take this, make sure, not even, some people will go, they will tell the doctor to prescribe it. Don't force your doctor to prescribe any ovulation stimulation drugs, because if you do, you are forcing yourself, you are putting yourself into trouble. Like I said, this page, I designed it to help women. I will tell you the truth. I will never deceive you. This is a very dangerous medication for anybody that do not need it. People who actually need this is people who have low ovarian reserve, people whose egg quality is low. But I always address people. I always like people. You see, since last week, I've been posting videos about clove water, okra water. People will think, why is she posting those things? They are very, 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 very active. Something that just use one and kill 100. Those things works very well, and they don't have side effects. For example, if you are taking clove water now, clove water will increase your air quality. Clove water will, wash your uterus, cleanse your system, solve other problems. But this one is being produced with chemical. Chemical is the fastest way, but I always like the natural way. So another one that can be used to stimulate your ovaries to release egg is this. This is called Ovitrella. I have shown it several times. You can write it down. Somebody can write it. Sarah is not here. Sarah is always, I like always seeing, wow, my sister is here. Oka Maka Ode. Oka, what are you doing here? Oka, welcome. This is Ovitrella. This one, Ovitrella, is, some people call it trigger shot. I throw the syringe away. It has syringe inside. This one is always used for people who undergo IVF, but ordinary person who have low air quality can use it. So this one, when the doctor will monitor your follicle. If you want to track your follicle, I think in Nigeria they have some gynecologists that have ultrasound that can help you to track your follicle. If you have money, it may be expensive. One after your period, you can meet them. They will tell you the day you will come. They will be tracking your follicle, tell you when your egg will be matured. So this Ovitrella is also another medication that is used to stimulate the ovary to release egg. So the syringe is not here. It's in form of syringe. If your doctor monitors your ovary, they know when you are likely going to ovulate. They will tell you it's a simple injection drug. You can keep it to yourself. You give yourself the injection. Then if you take it today, like tomorrow, you ovulate. And one thing I don't like about this is that this one, once you have taken this medication, if you give yourself this injection and the following day you go and test for ovulation, this thing, whether you are ovulating or not, the ovulation test will show you positive. Even if you do pregnancy test, it will show you positive, because this is hormone drug. This is hormone drug. Once you are in any hormone drug, if you make pregnancy test, it will show you positive. So if you take this one, if you give yourself injection, this one, people who undergo IVF, they always use it. If you take it, even that's why they will tell you that after this one and progesterone suppository, once you are under them, if you do pregnancy test, they will show you positive. So that's why people who undergo IVF, doctor will tell them that they should not do the test at home, because it will show them positive because of the hormone drugs they are taking. So this is how to fix ovulation problem on yourself, by yourself. Bear in mind that anytime you are not ovulating, there must be something hindering it. Anytime you are trying to get pregnant and you are not getting pregnant, there is something like somebody like me. If I want to get pregnant, I know what to do. I know how to plan it. If you plan yourself, you watch yourself, you work towards it, you will get it. So if you are trying to get pregnant and you are not getting pregnant, it means that something, especially when you are up to 35 years. 35 years is when hormonal imbalances always challenge you, because at this age, your body, your energy, your eggs, your strength is going down. When you eventually clock to 40, it's a dangerous time. Becoming pregnant at 40 is very, very dangerous and very hard. What I mean very hard, I don't mean that it will be very hard for you to become pregnant. For you to carry the pregnancy alone is a risk, you know. But some people will do it because, something you are looking for and you find it, no matter what comes up, you'll be very happy to do it. You'll be, and whatever pains that come, you'll be very happy to endure it, because this is what you are looking for. God have answered your prayer, so you wouldn't mind anything that comes out of it. But trust me, pregnancy at 40 is just like eating stone. So if you are 35 and you are still sitting down there, they will tell you to go and do this. You'll be sitting down there procrastinating. I will do today. I will go tomorrow. I will do this. My dear sister, please wake up. 35, you are already late. Yeah, that's why I blame some women who are not getting married earlier, or some people will get married, they will say let them enjoy. What are you enjoying? Once you get married, the next thing that should come into your mind is making babies. It's making babies. Believe me, any marriage that there is no baby, I don't think there will be happiness. Your baby will be the reason of your happiness. Even at the time there is something your husband will do to you, when you remember that you remember your babies, you will enjoy it. You will not even see it as an offense. But when you are there, you don't have babies, and somebody is provoking you. I don't know. I don't want to go into this. So now, if anybody have question, this is the question. I will ask you people my question. Can somebody tell me, what did you learn today? What did you learn today? What did you learn today? This is question time. Kid, Kidia say, what can you do? What do you, what to do to start seeing period? Um, Kiddy, what you should do is you should also go for hormone test, because when you are, how old are you? Are you under menopause? Have you entered menopause? If you are not, and if you have not entered your menopause and your period is not regular, you are not seeing your period, there is something that you don't force your period to come out. Please just go to your gynecologist, do hormone test, tell him that your period is not coming out. He already knows the test he will conduct to know. Because sometimes why your period is not coming out is hormonal disorder. Like if you have PCOS, if you have endometriosis, all these things can make your period. If you have cyst, when I talk about cyst, depending on, it's not every cyst that is harmful. That if you have diamond cysts, these are the ones that are very harmful, that can make your period not to be regular. Instead of forcing, because if you force your period to come out, how long are you going to be forcing it to come out? You need to know why it is not coming out. Then you fix that factor, so that once it start coming out, it will come out on its own. You don't need to force it again. The same thing applicable to people with hyperprolactin, people who have who will tell me what is hyperprolactin? I said it now. Please, if you have question, ask me. This is question time. This is question time. Ask question. This is question time. Question. Nobody wants to. And if you don't want to ask question, answer my own. What is hyperprolactin? I don't see stretchy mucus. It's milk white. Is but my ovulation test is always better. Milk white. No, it must draw. The cervical mucus must be slippery. Maybe one day I will demonstrate it how it happens. Like I said, if you are not seeing that cervical mucus, it's a sign that you are not ovulating. You might be ovulation kits. Let me tell you how this ovulation kits work. Ovulation test work. Ovulation test, if you look at it, they wrote LH. That's LH means luteinizing hormone. So this hormone, after your period, the follicle will start developing. So this ovulation kit would dictate it. Once those follicles are developing, they would dictate it. They wouldn't tell you if it is matured. If you look at it, some of them, the control line and the test line will not be more clear. They will not be clear. So it will not tell you. It's through ultrasound that you will know whether if this egg is really matured. I don't know if you understand me. So the best way to know if you have matured egg is through the use of ultrasound. Madam says, okay. Hyperprolactin, to my own understanding, means when your breast is releasing milk when you are not pregnant or breastfeeding. Nkiru, yes. Nkiru, you are right. Hyperprolactin. Hyperprolactin is when breast milk is coming out from your breast. You are not breastfeeding. You are not. Please, ma, how will I stop irregular menstruation? Henry Quinnet, you can stop irregular menstruation when your menstruation is not regular. It's the same problem of hormonal disorder. You need to find out what is making. For example, I don't know the type of irregular menstruation. Is it that every month you don't see it, or maybe your period is all over the places? If it is that you are not menstruating every month, please go for hormonal test and find out why you are having irregular. Or do you have PCOS? Do you have endometriosis? You do have cyst? These are the things that can cause the irregular period. My baby is 1 year old and I have my period and my ovulation, but I try to get pregnant. Goodness, go and sit down. Your baby is just 1 year. You want to get pregnant again. Have you stopped breastfeeding? Goodness, have you stopped breastfeeding? That is the question. Goodness, your baby is just 1 year and you have started scattering your brain. Your body still need time. Your womb self have not even settled down. You want to be among those people that will carry for hand, they will carry for belly. Allow your body to heal before you start. One, your baby is just 1 year. Your menstrual cycle need to be in order. Your womb self is not settled down. You want to carry another one. I will not answer you. Okay. Henry Quinn say what is PCOS? Is polycystic ovarian syndrome. It's a situation whereby a woman have multiple follicles in their womb. At the end of every month, none of them will mature. They will just be there. You will not release egg. It makes it nobody really know the cause of PCOS, and the cause of it is you see a lot of women that have men's hormone, like hair. You see a lot of the sign of PCOS. You have men's hormone. You see women that have hairs all over their body. But me, I have beard here, but I'm not having PCOS. Another sign is acne, pimples. Another one is being fat. So that is PCOS. Is the full meaning is polycystic ovarian syndrome, where you have multiple follicles that none of them vow to matured. Your prolactin level is 40, is very, very high. You need to go and meet endocrinologist. In 30, 20, 30, 20, 40, your patients, your prolactin level is very high and you are not ovulating. Whether you like it or not, you are not ovulating. you need to go and meet endocrinologists. These people are very good when it comes to hormones. What causes high prolactin? Stress. It have a lot of factors. Prolactin can be caused by stress. It can be caused by abortion. It can be caused by ectopic pregnancy. It can be caused by infection. It have many causes. So, but stress is one of them. Cynthia, I don't know if you are just coming. If you are coming, this is your question. You say releasing of breast milk when you are not pregnant or breastfeeding is what I'm saying, is what is called hyperprolactin. Your hyperprolactin level is high and you are not ovulating. It will make it difficult for you to get pregnant. Yeah, if your prolactin level is 17, is okay. It's okay. Anything 30, 20, 17 to 25 is normal. 30, 40, 50, 60. There was a woman I think I met in my platform. Her own was almost 200. 200. She wrote me, I told her what to do, and now her prolactin level is normal. So it's always good to don't go to your gynecologist to tell him to write medication that can reduce it. It's not good. When you reduce it and you become pregnant, if you want to get pregnant again, you start fighting it. It's better you go and meet in the chronologist. They will conduct tests. Maybe it's your blood sugar level that is making your prolactin level to be high. They will fix it. They will solve it. They will solve the problem from the grassroots. Good afternoon. Please, can you? I don't give people my number. You see people writing question. Write your question here, or you can write in messenger. I don't give people my number, please. So let me ask you people now. You people have been asking me. Let me know those that I will know those people. This is how I'll be doing it now. I think this week, by the grace of God, every day I'll be coming live. Tomorrow, don't miss tomorrow. Tomorrow I'm going to teach you or show you another way that you can detoxify your system, especially people who have cysts and all that. Join me live tomorrow. I will demonstrate it live in my kitchen tomorrow. We will do it together. So, my student, my fellow teachers, what is estrogen? If you have been following me, I know I'm seeing a lot of people here that that started this page with me. If I ask questions, they will keep quiet. Very soon I'll start calling your name. What is estrogen? What is the role of estrogen in a conception? Ejim, please. I don't know if Ejim's Lizzie. I don't know if this is your first time of following me. Please, you people should answer Ejim's. Ejim say, how do you know when you are ovulating? This is what I've been saying here. I'm not going to answer that question. Please, you people should answer her. Patience, that is not the track way to settle your hyperprolactin. I have told you what to do. Go to any teaching hospital. If you go to teaching hospital, you will meet these people. They are professionals. Maybe if you are in Nigeria, if you are in Lagos, you go to Root Teaching Hospital. If you are in Enugu, go to UNTH. If you are in Imo State, go to, what is this name of General FMC. When you go there, you will see these people are branch of doctors. They are very good when it comes to endocrine problems. They will test you and they will know what is causing your prolactin level to be high. I'm waiting for your answer. So what is the role of estrogen in conception? I will know the people that are serious. Somebody said, Lizzie said, how do she know that when she's ovulating? And I've been saying this thing since here. So what is the role of estrogen in conception? What is the role of estrogen? Please, I dey wait for your answer. I'm waiting for the answer. Igwe 2, this is not the answer to my question. Please share the program. Share this program and God will bless you. I am not forcing you, but if you share it, you will receive abundant blessing from God, because you are saving a lot of people. A lot of people will see the program, and they will learn, and their problem will be solved. What can somebody do to get back ovulation? Look at somebody. Who is this? Are you just coming now? This is the topic I'm treating. You are asking me later. When I off this thing, you go and rewatch it. That is your assignment. I'm waiting for my question before we call it a day. Lizzie, you are just joining. After the program, you go and rewatch it again, so that you get the full this thing. You get the full video. Please, anytime you come across my video, some people, I will post video, they will not watch it. They will just read the title. They will start asking questions. If you want to get the message or what you are looking for, please take your time, watch the video. My videos are not too long, highest 1 hour or sometimes 59 minutes. Take your time, watch it. You are looking for solution to your problem, watch the video. Nkiru say estrogen is produced in early pregnancy. It supports your baby till placenta takes over. You tried, but it's not you tried. Another person, I'm waiting for another definition before. You say, please ma, just had a miscarriage. Please, I am still pregnant. The miscarriage blood didn't flow well, and doctor said everything is okay and no period yet since 5 weeks. You need to who is this? Mercy Mavis, please, if you are here, I want you to pray for Mercy Mavis. She said, please ma, just had a miscarriage. Please, I still feel pregnant. The miscarriage blood. You don't need to feel this thing. What you need to do for you to clear your conscience, and that you need to go back to scan. Go to the scan. Use scan this time around. The doctor will check whether you are pregnant or not. Then after that, ask the doctor, why did you have miscarriage? Tell him or her to check your progesterone level. If you are under stress, please stop it. My sister Mira's kitchen is here. Mira said estrogen help the uterus grow, maintain uterine lining, regulate other kissing. Super. Mira kitchen got my €1. That's the word that I was looking for. Estrogen help the uterus grow. Yes, it maintain the uterine lining. Estrogen, once pregnancy occurs, the role of estrogen is to go and thickening the lining of your uterus. It's just like when you have a visitor, or before you lie on your bed and you go and prepare your bed. That is the role of estrogen. Estrogen goes straight to thickening the lining of your uterus, so that when the new fertilized embryo comes, they will implant successfully. So if you have estrogen disorder, it's going to affect your implantation. The egg will fertilize, but when it gets there and it doesn't see any place to attach itself, it will disintegrate and come out in place in form of your menstruation. So which other one? Is there anybody? Releasing of breast milk when someone is not. All this thing is just repetition. Good afternoon, ma. Please, my first time following you. I have not been seeing my period for about 7 years. How old are you? For 7 years now, I have been to many hospitals, but no solution for now. Have you done hormonal test? How old are you? Have you entered menopause or not yet? you answer me. Maybe you write to me in Messenger. Lena said, helping in baby development, no. And when it's time to breastfeed, estrogen promotes the growth of breast tissue and help milk flow. Yeah, estrogen promotes the development and maintenance of female characteristics of the body. Yes. Or Sigwina Andre. Faith, please, ma. Why is Faith repeating this question? He said, please, ma, releasing breast milk and not pregnant. I have said this. Please, if somebody asks question in the comment section and you know it, we all are teachers here. We all are teachers. If somebody asks question, you help me, because it seems I missed a lot of questions. If I missed your question, please don't be angry with me and one person. So I'm trying my best to see if I can answer. It started when I was pregnant. I take drugs instead, no solution. Faith, Reginala, I didn't understand what you are saying. It all started when I was pregnant. I take drugs instead. Did you go back? You see, when you are taking a contraceptive drugs, you need to be careful. That's why I like the Western words. If they give you, if they prescribe any contraceptive drug for you, they will check it if it matches your system. They will be checking it, because some of the contraceptive that is not that didn't match your body can make you to be infertile. So before you take anything, don't just go because you want to take it. Make sure that doctor prescribe this to you, and the doctor will also watch it. Doctor will also watch how this thing is, whether if it is compatible with your body. You don't just take it. I know a lot of women who take contraceptive drugs, and up till now they find it difficult to conceive again. Maybe the drug is against your... Good afternoon, ma. Please, ma, what causes brownish discharge during ovulation? It's normal. I said signs of ovulation. When you are ovulating, you may have light spotting, brown spot. It's normal. It's normal. It shows that you have ovulated. The doctor said everything is okay. I am not pregnant. Doctor check HCG level is now 0. I have also checked at home. No more pregnant. My breast is also heavy, and yes, you were pregnant before. Remember, you have miscarriage. The breast milk is there. What you need to do now, since the doctor have confirmed that you are no longer pregnant, the remaining blood is still there. Join me live tomorrow. I will do what you need to use to detoxify yourself. Do hot bottled water, that they call it castor oil, to make sure that the remaining blood flush out, so that it doesn't form to anything. It doesn't form endometriosis or fibroid. You need to detoxify yourself again. Trust me, you will be pregnant. As you are now, you are still like somebody who is pregnant. If you did not do anything, you will remain like that. You need to, since the doctor have confirmed that nothing is there, what you need now is to detoxify your system. Make sure that the remaining blood goes out from your body, so that you'll be able to get pregnant again. So, my lovely people, I enjoyed today's lecture. At least everybody is participating. It's not only me. This is the way we are going to be doing it. I will not be the one talking. We'll be doing it together. When you ask me, I will ask you my own. If you haven't followed the page, please, I believe you like what we are doing. Am I dreaming or what? Only 13 people share. Is it true? Or my eyes is... Please, can somebody help me check how many people that share this video? If you are here, you didn't share, you didn't do me well. Oh. You need to share this video. People need to see it, because this is the question that I received. That's why I stopped whatever I'm doing. If you are here, you didn't share. 13 people. Jesus Christ. Like, seriously, according to people who act Nigerian movie. Seriously, 13 people, over 100, and all those people, were they robots? Please, if you are here, you haven't shared this program. So we are going to stop here. Tomorrow, If I see the number of people who share the program, I will know whether I will do the detoxification video tomorrow. If you guys did not share, I will not do the video tomorrow. So these are the things that you need to do when you are not ovulating, so that Mavis, have you shared the program? I always write the time, because I don't like, I cannot tell you the time tomorrow until when I'm free. Like today, I found out that I'll be having time today. So, but tomorrow is from the share. When I see at least 40 people, 46 people share the program, then I will have more encouragement to come and sit down here. I'll be sitting here. I think it's not up to 1 hour now. So when I see the number of shares, I will know whether I will do the video tomorrow. But before I come live, I always write it that I will be live. So if I will do it, once you see me posting that in video tomorrow, if you are trying to conceive mother, that video, that detoxification that I will do tomorrow is very, very important. You must be here. So thank you so much. Until we see you again tomorrow.